What is the value of human life? What if that person is your loved one or family member? Now, what if that person is a drug addict? The question which comes to mind is, why do people tend to value some human lives less than others? That is what happens to people struggling with addiction. If you denied somebody with cancer chemotherapy, you would be looked at as a monster. Yet people with addiction are constantly denied life-saving treatment interventions. That is unfair and biased. Addiction and cancer are both deadly diseases. So why is there so much discrepancy in how the medical field chooses to treat them? There is a new approach to help reduce risks for people struggling with addiction called safe injection sites. This approach has taken off in Canada with success and is beginning to be introduced in America. Safe injection sites are a way to save lives. Maybe these are not the lives which society in general values, but these are still people living with a deadly disease, and they should be offered options to help them heal. Although intravenous drug use is generally frowned upon in society, safe injection sites should be made legal in the United States because they reduce overdose deaths, decrease infectious disease transmission, and increase the number of individuals initiating treatment for drug addiction. The most cutting-edge approach in treating drug addiction is the harm reduction model. According to Promises Behavioral Health, the harm reduction approach suggests that the concept of a drug-free world is not realistic. Therefore, reducing the harm that results from drug use should be the priority. This can come in many forms, but in essence, it reduces the risks associated with drug use. Most of those risks surround overdose and the transmission of diseases such as HIV and hepatitis C. There are many ways to implement the harm reduction model. Medication-assisted treatment and needle exchanges are a couple of the most common in the addiction treatment field. One of the most controversial harm reduction approaches is safe injection sites. In 1987, drug addiction was officially declared a primary and chronic brain disease by the American Medical Association. Though there has been a great deal of dispute about whether drug addiction is a disease or a choice, a board of medical doctors determined it is, in fact, a disease. Whether or not addiction is a disease will not be the topic today. Instead, we will be discussing the methods used in treating addiction. There have been several approaches to treating drug addiction. Therapy, rehabilitation centers, medication-assisted treatment, and incarceration to some degree are just a few. It is a battle that is being fought and often lost. Regardless of opinion, one thing is certain: human lives are being lost every day to the disease of addiction. According to Alex Kreit from the Boston College Law Review, and I quote, "Safe injection sites are places where individuals can safely use their own drugs under supervision of trained professionals," end quote. A statement with the words safe and drugs is bound to ruffle some feathers. However, the reality of the situation is, it is either these locations are allowed to exist, or there needs to be acceptance of the fact that it will continue to happen in public parks and bathrooms. Safe injection sites cannot eliminate the harmful consequences of drug use entirely, but they have been shown to reduce intravenous drug use in public places, reduce overdose rates, and increase the likelihood of individuals engaging in drug treatment. Amber Leary from the Brooklyn Law Review states safe injection facilities have been in operation since the 1980s in countries outside of the United States. The first safe injection site that was a government-sanctioned site opened in 1986 in Bernay, Switzerland. Since then, several safe injection facilities have opened around the world, around 100, but none in the United States. The United States appears to be behind on this trend, and the reason is evident: stigma and fear. According to the Centers for Disease Control and Prevention, overdose rates are at an all-time high, with a 5% increase since 2018. This is a huge cause for concern. There's a huge cause for debate on this subject because some people believe that addicts should be left to die of their disease. Alex Kroll from the American Journal of Preventive Medicine reports on a study that was done involving an unsanctioned safe injection site that was open in California for research purposes. This site supervised approximately 2,574 injections in which only 2 overdoses occurred. Both of those overdoses were reversed by the life-saving drug naloxone, so there was 0 drug overdose deaths. Naloxone is a drug that reverses the effects of opiates if administered fast enough after an opiate overdose of any form occurs. Safe injection sites make this medication readily available in case of an overdose. The fact that these sites have medical staff supervise all injections make it easier to administer. That alone is enough to greatly reduce overdose deaths. Human lives are not something that should be gambled with, regardless if that human is an addict or not. Intravenous drug use helps contribute to the spread of HIV, AIDS, and hepatitis C. The main cause of this spread is the use of dirty needles and unhygienic injection practices. The stigma associated with buying clean needles makes it difficult for addicts in active use to have a steady supply of clean needles. Alex Kroll from the American Journal of Preventive Medicine reports that in the U.S., HIV is present in nearly 2% of intravenous drug users, while Hep C is present in around 43%. That is a high number, and it's going to continue to rise. Unfortunately, used needles often get left in public spaces where addicts commonly use due to lack of a better place. Safe injection sites provide a clean and sterile environment to use in, clean needles, and proper disposal of needles. This reduces the risk of HIV and hepatitis C spread for addicts and the general public alike. One of the main arguments against safe injection sites is that it encourages drug use instead of encouraging drug treatment. This is cause for people to contest the validity or practicality of such sites. One factor overlooked is the inability to make contact with a population that generally hides in the shadows. How can drug treatment be introduced to people in active addiction if they have no reason to engage with healthy contacts in the community? The very reason that safe injection sites are criticized may very well be one of the program's biggest assets. Stephanie Aubin from the Interdisciplinary Journal of Health Sciences states, and I quote, "Safe injection sites are a useful way to come into contact with the drug-using population and expose them to treatment options," end quote. Stephanie Aubin also reports that in Vancouver, a safe injection facility was supervised for 12 months, and in that time, 2,171 referrals were made, with 37% of those being to substance abuse counselors. Often when addicts are in active use, they do not know where to turn for treatment. Safe injection sites provide them with an open door to treatment if they choose it. There are medical professionals present to make appropriate referrals when necessary. Making treatment accessible is key to the treatment of drug addiction. What better way than to create a safe space for users to not feel judged and to know that it is okay to ask for help? Integrated care is the model that is the best practice in addiction treatment today, and harm reduction is one of the cornerstones of recovery. It is an approach that is highly effective in dealing with a disease where everything else has failed. The concept of safe injection sites is health and social services at its finest. They do not encourage drug use, they simply create a safe environment for drug use that will be taking place regardless. According to the Boston College Law Review, drug use is currently taking place in public areas to include parks and restrooms. Safe injection facilities provide a needle exchange program, which reduces the likelihood of people sharing needles and leaving them in public spaces. They provide medical supervision so that the likelihood of an overdose is minimal to none. If overdose does occur, the life-saving drug naloxone is on site to prevent death. Safe injection sites do not provide illegal drugs to use. They simply provide a safe place to use substances that people suffering from addiction have already obtained. So what is the value of a life? It's easy to stand on a soapbox and preach about how people who use drugs are immoral and less than. Should having a deadly disease automatically be a death sentence? What if that person was your mother, father, sibling, or child? Would you want to take every measure necessary to save them? Safe injection sites are not only about saving the lives of addicts, they are about protecting the public as a whole. Everyone is so quick to demand better solutions to the opioid epidemic, but nobody has brought a better solution to the table. Safe injection sites are just that, the beginning of a solution to an unsolvable problem. They are about empathy and loving humans. They are about saving lives. The United States is so far behind in the trend of compassion, and it shows. It shows by the recidivism rates in jails, and it shows by the number of people with mental health diagnoses and co-occurring disorders living in the streets. It shows by the amount of hate and bias that is perpetrated in this country. There must be a better way. We are responsible for being open-minded and looking at the big picture in a more creative way. If there was a new controversial treatment to reduce the effects or symptoms of cancer, nobody would think twice about implementing it. We would save lives at all costs. How is it that one disease is considered shameful while another is considered a reason to be sympathetic? It does not make sense. We must do better for our society and our community before it crumbles. It is imperative that safe injection sites are made legal in the United States because they decrease overdose rates, decrease the spread of infectious disease, and increase the likelihood of people struggling with addiction to connect to treatment. This may not be an answer that everyone's comfortable with, but it's what's been effective thus far.